Hello, thank you for joining me today as we talk about mental health. Now, today we are seeking to understand how external factors affect the mental well being of students and whether the strategies that have been put in place in schools are effective. Now, I'm your host, Sandra Helen Omondi, and joining me today is Dr. Geoffrey Wango, who is a counseling psychologist. Dr. Wango.
Thank you very much, Sandra.
First of all, thank you so much for joining us today on this topic. I understand that there are so many assumptions on what mental health is. So, according to you, what is mental health?
Thank you. The mental health has to do with our health well-being, and it encompasses several aspects. It has the spiritual, it has the mental, it has the physical, it has the moral, it has the intellectual, and it involves someone's well functioning. So when the person is functioning very well, we say that they are mentally healthy. And when they are not functioning as much as well, we say that they could be mentally ill or mentally dysfunctional, or they could be having a situation where they are not doing as well as they should. And when it comes to anybody can be affected by mental health, young or old, male or female, and all kinds of people, race, ethnicity, and all that. So it affects all of us differently somehow sometimes.
Now, students are mostly seen to be the ones who are affected mostly by mental health issues. So, how do external factors like social media, economy, how does it affect the mental health of students?
Okay. Students are affected by mental health for various reasons. One of them is because they are much younger, obviously, and therefore they have what we call childhood challenges. So they may not have overcome them as best as the adults could have done. So the fact that they are growing up means that they are struggling with several issues in society. So they are struggling with the peer pressure that you've mentioned. They are trying to find out who they are. First of all, there is their identity, and there's a lot of pressure from their peers, the groups who are trying to show them one or two things, and this can have adverse effects like engaging in sexual activities. It can also lead to several aspects like drug and substance abuse, and it can also lead to teenage pregnancy. And this puts a lot of pressure on them. And in actual fact, with time, it can lead to frustration, disappointment, depression, and then what we call now mental health. You can imagine a young person, maybe a girl, struggling with teenage pregnancy, and they are trying to find out who they are and who they want to become. And at that point in time, they have a child to carry. And this is a child carrying another child. So they are what you have said, the internal and the external factors. The internal factors has something to do with the person struggling with their lives. But then there is also the external, the pressures, the need to excel in academics. Very, very important in many ways. Like the need to excel can come from the individual and from the society. The society is both the teachers and the school. Because everyone wants them to excel, to be 1, 2, 3, 4. I think there's social media. The social media is trying to show that when you're out there, you are successful. Maybe success is another different word to define. And you're doing very well. You have money. You have big careers. Now, big careers is also another word to define, because some people would consider some things like the law, the lawyers, the doctors, the journalists, international journalists, and all that, like the careers. But you have many other careers in between that people don't tell the children about. And therefore, that's why the student can have a lot of pressure going on within and without them.
So, would you say these factors contribute to rising anxiety rates?
Exactly, yes. These factors lead to rising anxiety rates. Because when a child, for instance, if you pick a child in school, when they go to Form 1, they have not fully developed. So they may not understand fully the implications of academic performance. But by the time you reach Form 2, Form 3, and you're teaching the subject and the careers, the pressure now is on you. And the parents are already telling you, hey, in 1 or 2 years, you're going to have an exam. So the pressure builds up on you. And remember, the parents are also trying to excel, because they would be peers as parents also. Have children who are doing engineering, they are doctors, they are surgeons, they are pilots. So you see, this pressure is put on the child and the teachers. Because the teachers are also trying to say, you must get that A grade. So you see now we start classifying grades in terms of there's a good grade and a bad grade. And we are not looking at the child's performance. because the child's performance is essential, and not whether they are over exemplifying themselves in what you'd call the academic field. Because every performance is good. It depends on the child's ability, and every career that the child takes is important. So this classifies careers into classical and would be lesser careers, and children who perform and children who do not perform. And that's why we hear parents even saying that, you see, what kind of a mark is this? Whom do you take after? Your parents, your brother, your sister? And this can have a lot of effect. I remember one time during the exams when one of the students had scored a 90 out of a possible 500. And you can imagine the parents saying this is below a dollar, because the dollar at that time, the exchange rate was about 130. So you can imagine, how does that child feel? And how does it affect their self-esteem, their sense of belonging, and that they are a failure? The fact that you are a failure means that you can't succeed in anything in life.
Now, I understand that there are so many societal attitudes on mental well-being and mental health. So, do these attitudes really impact students who are willing to seek help, or is it just a matter of it's just about the person themselves?
The impact is, first of all, we come from a society where we see mental health in terms of, first of all, the family doesn't want anybody to know we have someone who is psychologically disturbed, obviously. And then we want everybody to start from where we began, mental health. Everyone is okay. But then obviously there are certain things that fall by the wayside, the frustrations, the disappointments. So the parents themselves want to look like everything is okay. Nobody has a problem here. But now you can imagine this person who is undergoing a lot of issues. So they can even hide this would-be child or student who in turn does not receive the necessary attention, medical attention, even we say social attention, therapy, and all that. And that in turn affects the child. That's why in our society, in the more of our society, the more traditional societies, we don't, most people don't seek counseling, because they don't want to be seen to be sick. So aspects like counseling and mental health are seen as the lesser people, rather than the ordinary. And yet mental health is, or when sickness with mental health, is a sickness like any other. And the person is actually a patient, just like any other patient.
So, as a counseling psychologist, are there strategies or supportive measures that have been put in place to specifically help students who are facing mental health issues?
Very important. There are two measures that are put. The first one is the proactive. You see, for the person to maintain their mental health and not be deluded into aspects like drugs and substance abuse and others. There is a lot of guidance and counseling that is done for students, both in school, and it's supposed also to be taken up by the parents. That is why the Education Act, the responsibility of guiding the child is with the parent. So the guidance and counseling on one hand is supposed to sort of protect the child from would-be efforts in society, drug and substance abuse, teenage pregnancy and all. But if the child is psychologically disturbed, like other events coming, like you say, the external, divorce and separation in a family, very unfortunate. And of course, the most unfortunate other aspects like loss and grief, the death of a parent or a loved one. The child is supposed now to receive counseling on the other end. So the guidance is more to guide the child, whereas the counseling is the therapy that is supposed to, it's an intervention that is supposed to assist the child to get back to regular life, not ordinary. Because when the parents has passed on, there are some insinuating circumstances. That's not regular. That is not ordinary life. That is regular life. So that's why we say the child needs to be assisted, to live regular life, to get back to the ordinary day of living. So it is not actually an ordinary life like where you say the child will forget. Not necessarily.
So there are also some measures that have been put in place in schools, like counseling departments. There are offices that are in schools. Do you think they are effective in trying to help students cope with these issues?
I like that. First of all, it's true. There are the guidance rooms, there are the guidance and counseling rooms, there's the career talks. They are effective to an extent, but to another extent, they may not be as effective. Let us accept that there's too many contemporary issues and challenges. We've been dealing with the challenges in Kenya for the last so many years on HIV and AIDS, which has had its effect. But now we've have had the COVID, which definitely was the more devastating. There are other aspects. Now the deaths are more common. There are deaths on the road, accidents. Then there is divorce and separation and issues to do with family. So that means that there is need for retraining the would-be teacher counselors so that we can deal with the more modern effects, adverse effects. And then we also have aspects like the growing family, the childhood challenges, unfortunately sometimes the toxic parents, the abusive parents. So this is a big challenge.
As we have seen and heard, internal and external factors do take a toll on mental well-being. It is up to you as an individual to not let these external factors such as social media affect your mental well-being. As students, we cannot deny the fact that these external and internal factors play a part in affecting our mental wellness. Do not hesitate to seek help if you feel like things are getting overwhelming.